So, today we are going to discuss hepatitis, that is A, B, C, D, and E. So, here we start. What is the word hepatitis means? This is the disease caused by viruses that attack the liver, and we usually discuss about five important types of the viruses, that is hepatitis A, B, C, D, and E. So this is just a brief review of different type of hepatitis. टोटल 5 किस्में बताई हैं हमने, जिसमें जो हेपेटाइटिस ए है वो आरएनए है, बल्कि आप यूँ याद रखें कि हेपेटाइटिस बी के अलावा सारे जो हेपेटाइटिस हैं वो आरएनए वायरसेस हैं। सिर्फ जो हेपेटाइटिस बी है वो डबल स्ट्रैंडेड डीएनए वायरस है। That would be more easy for you. So whenever you see a word titus, it means inflammation. This is simple concept. So hepatitis means inflammation of the liver. So viral hepatitis, the inflammation of the liver caused by the virus. So the story begins, जब एक वायरस आके अटैक करता है लिवर की, तो it send its material inside the cells, that is the cell is infected, और उसी उसकी सरफेस पे आके कुछ सब्सटेंसेस बॉडी के अटैच हो जाते हैं, जिसको मेजर हिस्टोकम्पैटिबिलिटी कम्प्लेक्स कहते हैं। बेसिकली ये जो मटेरियल है ये अट्रैक्ट करता है CD8 and T cells को। So what happens is that CD8 and T cells becomes attracted to these major histocompatibility molecules, और ये सारे का सारा सेल जो है ये सेल्फ किलिंग और साइटोटॉक्सिक किलिंग का शिकार होता है। This is called cell apoptosis. So in the end of the day, these cells become what is called councilman body, present into the portal tracts and lobules. So when this process continued on a larger scale, so whole liver is being damaged. And there will be symptoms, of course, like fever, malaise, nausea, and there would be hepatomegaly. Hepatomegaly is because of continuing inflammation. When the liver enlarge, there is stretch on the liver capsule, which causes tenderness. So here comes a important question. There are different causes which cause a tender liver. They are the acute hepatitis number 1. Number 2 are the abscesses. Number 3 are the congested liver. And number 4 is METS. Either it is a primary malignancy or a secondary malignancy. So it causes pain, of course. Meanwhile, when this all process is being continued, blood transaminase level do increase, of course. Blood transaminase level increases. So this is due to the breakdown of amino acids. Here is increased in alanine aminotransferase, that is ALT, and also there is increase in the AST, aspartate aminotransferase. However, ALT is increased more as compared to the AST, and it lasts for a longer time in the blood as compared to the AST. So here comes atypical lymphocytes as well. These lymphocytes are large. They are from antigen stimulation which form in liver, and also there is appearance of jaundice. Both conjugated and unconjugated bilirubin increases. So what happens is basically bile duct leak is there, so conjugated bilirubin directly comes into the bloodstream. This is the one way. And the second way is unconjugated bilirubin is unable to be converted into conjugated bilirubin by the hepatocytes due to its continuing damage. So the level of unconjugated bilirubin also rises. So this is the basically source of conjugated and unconjugated hyperbilirubinemia. So what happened is that both of these unconjugated and conjugated bilirubin goes into the bloodstream and the level increases so much so that the conjugated bilirubin become excreted more from the kidneys, which causes a dark urine. Similarly, at the same time, there is increased level of urobilinogen into the blood. And where does it come? Normally, the bile by the microcytes of the intestine is converted into urobilinogen, which goes back to the liver, which is called enterohepatic circulation. But because of the hepatitis, this circulation is being finished. So urobilinogen is directed towards the kidneys and there is increased excretion into the urine, that is hyperurobilinogenuria. So in the urine there is more conjugated bilirubin and more urobilinogen levels. Acute and chronic hepatitis. What is acute and what is the chronic hepatitis? Whether liver inflammation lasts for 6 months, this is called acute. And what is more than 6 months, then it is called chronic. So there is continuing inflammation of the portal tract. So this is the post-meal or post-necrotic cirrhosis occur. And here comes a scenario you can see. You can read this scenario. This is best of 5 type. I'll give some time. You can pause the video later on. So we will discuss the answer of the scenario later. First we see there are the 5 type of hepatitis. One is the hepatitis A. So here we discuss their transmission, initial symptoms, and how it basically presents. So the transmission is from the fecal-oral route, that is the unhygienic food which is being contaminated by the viral elimination from the feces. So it more occur in the travelers, of course. It causes acute hepatitis only. There is no chronic phase in hepatitis A. When we do blood test, we have hepatitis A IgM antibodies that present acute infection and hepatitis A IgG antibodies which present recovery or vaccination status. So there are only two tests, hepatitis A IgM antibodies and hepatitis A virus IgG antibodies. Then comes hepatitis E. ए और ई को हमने इसलिए कंबाइन किया है कि ये दोनों एक जैसे हैं, इसकी ट्रांसमिशन भी फोकल है, लेकिन जो इम्पोर्टेंट चीज़ है वो ये है कि hepatitis E comes from uncooked seafood in addition to the other sources of hepatitis. It has similar acute, there is no chronic phase. Serology have similar things, hepatitis E IgM antibodies which show active infection and hepatitis E virus IgG antibodies which show recovery. However, there is a difference that it has got no vaccination. So whenever there is hepatitis E virus IgG antibodies, it doesn't mean vaccinated status as in hepatitis A. Also, in pregnancy, hepatitis E is dangerous. It causes fulminant hepatitis and it is associated with mortality more than 70%. The third type is hepatitis C. The transmission is, before discussing the transmission of hepatitis C, look back in this scenario. So this female presenting in gestation, must we think of hepatitis E? So this is the explanation you can see. So coming back to hepatitis C, the transmission is from blood, syringes, childbirth, unprotected sex. It causes both acute and chronic phases. It has got multiple causes. like enzyme immune solvent assay, hepatitis C virus IgG. This is not protective, however, it should be remembered that then is the recombinant immune blot assay. It has got increased specificity but no sensitivity, of course. Then the hepatitis C virus RNA, like hepatitis C virus PCR detection, which is in fact the gold standard for the diagnosis of hepatitis C. So whenever there is hepatitis C, we'll go for hepatitis C virus RNA PCR qualitative. Role of quantification and genotyping is now almost obsolete and is confined to just research purposes. Hepatitis B, we think it as a separate virus and we discussed it separately because it has got a long story. Transmission is similar with the childbirth, syringes, blood, unprotected sex. It causes acute hepatitis and chronic hepatitis both, and 20% of all goes into the chronic phase. This is in opposite to hepatitis C, in which 80% goes into the chronic phase. Well, hepatitis B virus chronicity depends upon the age of acquisition of hepatitis B. If the age is less than 6 years of age, 50% more likely to go to the chronic phase, and it is also linked to the liver cancer. It is important to remember the serology for hepatitis B. There are few test markers which are available like hepatitis B virus antigen. They may be present or absent. And before discussion of before discussing, we see there is a surface antigen, hepatitis B surface antigen. This is written like this, hepatitis B surface antigen. This is basically supervillain of the story. Remember, this lies on the surface of the liver here, and this is the supervillain in the story. Then there is a core antigen, which is called hepatitis B C antigen, which is basically a henchman who help this supervillain. Okay, then there are hepatitis E antigen, which shows viral replication and acute or active infection. Then there are viral DNA, which may be present or absent, which shows infectivity of hepatitis B. So we have got group of things which should be remembered. One is hepatitis B surface antigen, that is supervillain. Then is hepatitis C antibodies, that are the core antigen, which is basically a henchman. Then the E antigen, which show active infection and replication. And then the virus DNA, which shows infectivity of the hepatitis B. While on the other side of the picture, at the onset of infection, we have a supervillain and its henchman along with E antigen and viral replication markers. So at the onset of infection, we have got all these things present in the blood. While on the other hand, we have got IgM antibodies core, which act as a policeman. Now this policeman is active against this henchman in the viral infection. But for this supervillain, we need a superhero. So in our story, superhero is these IgG antibodies. These are the surface antibodies. This is basically a superhero. So in the cascade of the story, here comes a period which is called window period, which lasts for weeks or months, in which we have got just a policeman which is present in the blood. That are the IgM antibodies or IgM core antibodies, in which all the other things would be negative and the patient would be fine. So it is important to recognize this period because it doesn't mean anything. It may last for some times, then it can turn into any way like if the hero wins. This is a fantastic situation when only superheroes left into the blood. While if the villain wins, then there is of course villain is present along with the henchman, with the virus replication and DNA as well, and the policeman of course. But policeman as usual is not as actively working as a superhero do. Policeman is also present when the hero wins. When it is present, it is of course IgM, and after 6 months, it is converted into IgG. Look now the difference. In this situation, if the surface antigen, that is the superhero, is present into the blood, then IgM conversion into IgG means this is a cured, protected, or vaccinated individual. While in the absence of superhero, IgG is yet present here, but it doesn't mean anything. This is not protective at all. So protection needs policeman loses alone. If it is present alone, it loses. But if it is present along with the superhero, then it means a win situation. So we have seen this in the previous slide as well. So we have got two things now in the chronic infection. Number one, this is the healthy individual in which there is a policeman, there is a supervillain, but there is no replication, that the virus DNA and E antigen is absent. So this is less contagious or not contagious, not replicating chronic carrier of hepatitis B. While in other situations, it is infective carrier which carries supervillain, henchman, E antigen, virus, along with the policeman which have got nothing to do. So this is a post-infective or the person who can develop cirrhosis as the infection is continued, and also this is infectious as well for the other individuals, and also the chances of hepatocellular carcinoma is more in this patient. So to cut short the story, here comes the situation when we do immunization. If we do immunization, we directly jump on to this status while our hero wins. So if we cut short from all this, this is the situation which we acquire from immunization. This is an important table you must have seen in different books. So it is very easy to understand this table now. You can have more attention on this table and you can memorize it easily if you remember the story of superhero and supervillain. So this is some of the new nomenclature of the chronic phases. This is easy to remember, nothing to told about. This is the phases of chronic hepatitis B virus infection. So what is Delta virus, HDV? This is basically a defective virus or Delta virus which needs hepatitis B. It can come into two ways. Either it is a co-infection that both hepatitis B and hepatitis D comes together, or it is a super infection, that is patient is carrying hepatitis B and then comes hepatitis D virus, and of course super infection is more severe as compared to the co-infection. Among the serology we have got hepatitis D, IgM and IgG. IgM shows infection and IgG is not protective in this scenario as well. So it comes up with the clinical features. Hepatitis A incubation period is almost 30 days, and jaundice depends upon the age of the infection, less than 6 years, less than 10% Chances of jaundice 6 to 14 years 40 to 50%, in more than 14 years 70 to 80% of the patient develop jaundice. Complications include fulminant hepatitis, cholestatic hepatitis, relapsing hepatitis maybe, but there is no chronic sequel of the disease. We have got deep jaundice, pale stool, white urine, a white stool and dark urine. Vaccination is available against hepatitis A, that the Havirex, or second vaccination is ACUTE. Hepatitis B and C in acute phases. This is the common presentation with nausea, vomiting, malaise, aversion to smoke, fever, enlarged tender liver, jaundice. Cell lines may be normal or markedly elevated aminotransferases. Liver biopsy, which is rarely required nowadays, shows hepatocellular necrosis and mononuclear infiltrate. This is a summary of all five hepatitis: A, B, C, D, and E, and you can summarize this on one page as well. This is the older slide just to show one thing, that there are only two hepatitis in which vaccination is available: hepatitis A and hepatitis B. Hepatitis A only one injection, which is protective for 10 years, and hepatitis B is 3 injections which have lifetime protection. The sequence of the injection is, there are multiple sequences: 0, 3, 6, that is injection, then injection repeat at 3 months, then injection repeat at 6 months, then 0, 1, 2, injection, repeat at 1 month, repeat at 2 months. Then the more rapid course, 0, 1, and 3, injection, repeat after 1 week, repeat after 3 weeks, that is in the 1 month vaccination schedule. So this is the hepatitis A treatment. This is just a bed rest and nothing else. IV fluid sometimes if the vomiting is more. Dietary management consists of palatable meals without overfeeding. Breakfast is usually tolerated in this patient. Physical exertion should not be there. No alcohol consumptions, no hepatotoxic agents. Corticosteroids are not usually benefited in this viral hepatitis. Hepatitis B virus treatment is somewhat tricky, and before going to the treatment we have to discuss many things, like first of all is this scenario. So the scenario is about the goals and the endpoints of the therapy. The main endpoint, the valuable endpoint, additional endpoint, and optimal endpoint. You should remember this: the main endpoint is loss of long-term suppression of hepatitis B virus DNA, of course. Hepatitis B e antigen loss or seroconversion is an additional valuable endpoint. Additional endpoint is ALT normalization, and optimal is hepatitis B surface antigen loss. Indication of the treatment: we have got different groups: should be treated, may be treated, and can be treated. You can see and you can learn this by heart by yourself. And after the treatment we of course have to follow the patients 3 to 6 months, maybe 6 to 12 months, depending upon different categories. This is the algorithm for the management of chronic hepatitis B virus infection. This is the treatment among the patient hepatitis B along with hepatitis or HIV or hepatitis D virus. Healthcare workers in the special groups, you can see this, and in the pregnant women, healthcare workers we will discuss later on. In the pregnant women, this is the chart you can follow. Screen for hepatitis B in the first trimester, childbearing age without advanced fibrosis planning to pregnancy in near future may prudent to delay therapy until the child is born. In the pregnant patient with chronic hepatitis B virus and advanced fibrosis or cirrhosis, therapy with tenofovir is recommended. In the pregnant women already on nucleotide antigen therapy, tenofovir should be continued while entecavir or other treatment should be switched to tenofovir. In all pregnant women with hepatitis B virus DNA more than 200,000 international units per ml or hepatitis B surface antigen more than a certain level, antiviral prophylaxis with tenofovir should start at the week of 24 to 28 and continue up to 12 weeks after the delivery, which decreases the rate of transmission from mother to the fetus. Breastfeeding is not contraindicated in hepatitis B surface antigen positive untreated women or those on tenofovir based treatment or prophylaxis. This is among the children, and this is for the health workers. Health workers should be treated even at the lower levels of hepatitis B virus DNA. This should be remembered. So tenofovir and entecavir have potent hepatitis B antiviral effects and are recommended first-line treatment for chronic hepatitis B. Tenofovir treatment has lower risk for hepatocellular carcinoma than entecavir treatment in the patient with chronic hepatitis B. This is the latest regulations. For hepatitis C, there is just one slide. WHO decided or set a goal that they will eliminate hepatitis C virus threat by 2030. So fosbuvir and velpatasvir pan-genotype drug is available, which is given for 3 months for the treatment of any type of genotype of hepatitis C. So fosbuvir and velpatasvir, this should be remembered, just 12-week treatment. That's all about hepatitis A2, A, B, C, D, E. Thank you.